Good day to you and welcome to my YouTube channel. My name is Atinuke Deborah Akinla, popularly called Pada. I am a trauma, abuse and addiction therapist. So for the next 3 weeks, I will be taking the topic overcoming addictions, all right? For the many years that I've been doing therapy work, I have seen people walking up to me and asking me, what is addiction? Do you think I'm addicted? Do you think this is what I'm supposed to do? I am not addicted. Okay, let me just simplify it right now. What is addiction? Addiction is a chronic, lifelong condition that involves compulsive seeking and taking of a substance or performing of an activity despite negative or harmful consequences. An addiction will affect your health. Addiction will affect your relationships. In fact, overall quality of life. It's important for you to seek help as soon as you develop signs of addiction. I know the reason you are possibly watching this video is because you want a way out. Fine. Another person asked me some time ago, is addiction a disease? And I said, yes, it is a disease. It's a chronic condition. Addiction is a chronic condition that will affect many aspects of your life if you do not seek for help, including your physical and mental health. It will affect your relationships. It's going to affect your careers. And there are two main forms of addictions, really. There's a substance addiction that is also called substance use disorder, and then non-substance addiction called behavioral addictions. But in this episode, I'll be talking about the substance addiction, that is the substance use disorder. So follow me. And so I'll be giving you step-by-step guide on how you can cope with cravings, how you can deal with relapse, and also overcome your substance use disorder. And so the first thing I'm going to talk about is the first step to overcoming drug abuse and addiction. And let me just mention this. It takes more than willpower for you to overcome the problem. You cannot DIY your recovery. You cannot do it yourself. You need people around you. And abusing illegal or certain prescription drugs will create changes in your brain, and it will cause powerful cravings and a compulsion to use, which can make sobriety seem like an impossible goal, but recovery is never out of reach. Just know that no matter how hopeless you think your situation seems, or how many times you have tried and failed before, with the right treatment and support, change is always possible. So for many people struggling with addiction, the toughest step most of the time towards recovery is the very first one. And that is you recognizing that you have a problem and also deciding to make a change. Are you with me right now? So it's normal for you to feel uncertain about whether you are ready to start recovery process, or if you have what it takes to quit. If you are addicted to a prescription drug, let's say for instance pentazocine, you may be concerned about how you are going to find an alternate way to treat a medical condition. It is okay to feel torn. Committing to sobriety involves changing many things. You are going to be changing the way you deal with stress. You are going to be changing the people you allow into your life. You are going to change what you do in your free time. You are going to change how you think about yourself. You are going to change the prescription and the over-the-counter medications you probably are taking. It's also normal for you to feel conflicted about giving up your drug of choice, even when you know it's causing problems in your life. So recovery requires time, recovery requires motivation, and it requires support. But by you making a commitment to change, you can overcome your addiction and regain control of your life. So think about it. Think about the change you want to make right now. How do you think about it? First of all, you keep track of your drug use, including when and how much you use. This will give you a better sense of the role the addiction is playing in your life. And also, take a journal and list the pros and cons of quitting, as well as the cost and benefit of you continuing that drug use. Then consider the things that are important to you, such as your spouse, your children, your career, your health, even your pets. How does your drug use affect those things? Ask someone also you trust about their feelings on your drug use. Ask yourself if there is anything preventing you from changing. What could help you make the change? Are you with me? All right, so how do you prepare for change? I'm going to be giving you 5 keys to addiction recovery. Number 1 is for you to remind yourself every time continuously remind yourself, yes, right now you are committed, you have made up your mind that you are going for recovery, you are going for rehabilitation or whatever. You have convinced yourself, you have motivated yourself, you've thought about the changes that is going to happen. Now, how do you prepare for that change? You have to remind yourself again of the reasons you want to change. Think about your past attempts of recovery, if any, what worked, what did not work. And then you go about to set specific measurable goals, such as a start date or limits on your drug use. Another thing you can do is also to remove reminders of your addiction from your home, from your workplace, and other places you frequent. Even before starting that treatment, just remove those reminders. Tell friends, call your family members, and tell them that you are committing to recovery and ask for their support. Like I said earlier, you cannot do it all by yourself. Recovery is not DIY. You need a support system. And so now, after you have prepared for change, now it is time for you to explore your addiction treatment options. What do I mean? Once you have committed to recovery, it is time for you to explore your treatment choices. While addiction treatment can vary according to the specific drug you took or the years that you have used that drug, a successful program will always, often requires different elements. For instance, it will require detoxification. That is usually the first step, to purge your body of drugs and then manage the withdrawal symptoms, all right? And then another one that is likely to happen wherever you go to is behavioral counseling. Individual, group, and or family therapy can help you identify the root causes of your drug use. It will help you to repair your relationships and learn healthier coping skills. And also, medications may be used to manage your withdrawal symptoms, to prevent relapse or treat any co-occurring mental health conditions such as depression or anxiety. And also, you must also bear it in mind that long-term follow-up will help you to prevent relapse and maintain your sobriety. So this may include you attending regular in-person support groups or online meetings to help keep your recovery on track. Let me quickly give you the types of drug treatment programs that are available. Wherever you are listening from, whether you're in Nigeria or outside Nigeria, there are different types of drug treatment programs. Number one is called intensive inpatient treatment. This is a short-term clinical treatment for people who have developed a physiological dependence on a drug and they need help with withdrawal symptoms. Number two is what we call residential treatment. This one involves you living at a facility and then getting away from work, getting away from school or family, from friends, and anything that can trigger that addiction while you are undergoing intensive treatment. So residential treatment usually lasts from 30 days to several months. It depends. And also there is day treatment, or what we call PHP. PHP is partial hospitalization programs. Partial hospitalization is for people who require ongoing medical monitoring, but they still wish to stay at home. They want to have a stable living environment. So this treatment program usually meets at a treatment center for at least, let's say, 20 hours a week, but you return home at the end of each day. That is for PHP. There's another one that is similar to PHP. We call it IOP, and that is intensive outpatient program. IOPs, like PHPs, IOPs don't require you to live at a treatment center. However, they are different from PHPs in that they only require between 9 and 19 hours of treatment each week, so that you can schedule treatment around school and possibly work. And also there is therapy. That is the last one, but not the least, of course, I'm going to be mentioning in this series. That is one-on-one or group therapy sections. It will also be very useful to develop your coping skills, for you to identify triggers and also exploit the root of your addiction. Remember that everyone's needs are different. For example, not everybody requires medically supervised detox or an extended stint in rehab. Whether you have a problem with legal, illegal, or prescription drugs, Addiction treatment should be customized to your unique situation. It's also important for you to find a program that feels right for you. How do you find the best drug addiction treatment for you? Let me quickly give you some tips. Remember that I said that no treatment works for everyone. There's a particular suitable one for your own, for your offer to treat you. Everyone's needs are different. Whether you have a problem with illegal or prescription drugs, addiction treatment should be customized to your unique situation. It is important, that is why it is very important for you to find a program that feels just right for you. Treatment should address more than just your drug use. I have that belief, and I've always been telling people. Why? Because addiction affects your whole life. Addiction affects your relationship, it affects your career, it affects your health, it affects your psychological well-being. So you should address more than just your drug use. Treatment success depends on you developing a new way of living and addressing the reasons why you turned to drugs in the first place. For instance, if your drug dependency developed from, let's say, a desire to manage a pain or to cope with stress, in which case you will need to find a healthier way to relieve pain or to handle stressful situations. Are you with me now? So, commitment and follow through are key to your recovery. Drug addiction treatment is not a quick and easy process. I've always been emphasizing that. In general, in fact, the longer and more intense the drug use, the longer and more intense the treatment you will be needing. And in all cases, long-term follow-up is crucial to your recovery. There are many places you can turn to for help. Not everybody requires medically supervised detox or an extended stay in rehab, like I mentioned earlier. The care you need depends on a variety of factors. It depends on your age, your drug use history, your medical or psychiatric conditions. In addition to doctors and psychologists and psychiatrists and psychotherapists, there are many clergy members. There are many social workers and counselors that offer addiction treatment services. So you can also look at that, okay? So seek treatment for any mental health problems also simultaneously. As you seek help for drug addiction, it's also important for you to get treatment for any other medical or psychological issues you are experiencing. Your best chance of recovery is by getting combined mental health and addiction treatment from the same treatment provider or team. It is better. So don't try to do it alone. It's not going to work out. Reach out for support. Whatever treatment approach you choose, having positive influences and a solid support system is very, very essential. The more people you can turn to for encouragement, the more people you can turn to for guidance and a listening ear, the better your chances for recovery. All right, so lean on close friends, lean on family members, because you having the support of your friends, I mean, those friends that will not put you on danger list, you know what I mean? And also family members, that is an invaluable asset in your recovery. If you are reluctant to turn to your loved ones, probably because you have let them down before and they likely not trust you again, then consider going to relationship counseling or a family therapy. So build a sober social network. If your previous social life revolved around drugs, you may need to make some new connections. It is important for you to have sober friends who will help, who will support your recovery. Try taking a class, join a church or a civic group, volunteer or attend events in your community. And also, if possible, consider moving into a sober living home. Sober living homes provide a safe, supportive place to live while you are recovering from drug addiction. Example in Nigeria is Carrie's House. They are a good option if you don't have a stable home or a drug-free living environment. Make meetings a priority. That's another thing. Join a 12-step recovery support group. You can join Narcotics Anonymous. You can join Alcoholics Anonymous. Attend meetings regularly, especially if you are a drop-in. If you like drop-in therapy, okay? If you are just going and coming, make sure you are spending time with people who understand what you are going through, because that will be very that will help in your recovery process. You can also benefit from the shared experiences of the group members and learn what others have done to stay sober. So learn healthy ways to cope with stress. That's another thing. After addressing your immediate problems with addiction and then you've started treatment, you will still have to face the problems that led to your drug abuse. Don't forget. Did you start using the drugs to numb painful emotions? Were you using the drug to calm yourself after an argument, or maybe to forget about your problems? They will still be there. Once you are sober, the negative feelings that made you go into drugs or alcohol will resurface. So for treatment to be successful, you will first of all need to resolve your underlying issues. There's always an underlying issues. There will always be a trigger. There will always be a stressor. Once you have resolved your underlying issues, you will at times continue to experience stress. There will be times you will still experience loneliness, you will still experience frustration, you will still experience anger, shame, anxiety, name it, hopelessness. These emotions are all parts of a normal life. And they are all a normal part of life. So finding ways to address those feelings as they arise is an essential component to your treatment and recovery. And there are healthier ways to keep your stress level in check anyway. You can learn to manage your problems without falling back on your addiction. When you are confident in your ability to quickly distress, facing strong feelings is not as intimidating or overwhelming as you think they are. So you can quickly relieve those stress or that stress without drugs. And I'm going to be giving you different quick stress relief strategies that can work for you. Of course, the key is to find the one that works best for you. Number one thing that I tell people, strategy is movement. A brisk walk around the place you live can be enough to relieve stress. Yoga and meditation are also excellent ways to bust stress and for you to find balance. Another way is for you to just step outside and survive the warm sun and just take in the fresh air. Just enjoy a beautiful view or the landscape. Another thing is for you to play with your dog. If you're a pet lover like me, play with your dog, play with your cat, enjoy that. There's this relaxing touch, the relaxing touch of your pet's fur. Just enjoy it. And also you can experiment with your sense of smell. Yes, think of a sandy beach. There's this fond memory, maybe your child's first steps or the time you spent with some good friends. Another thing you can do is for you to pamper yourself. Pamper yourself, make yourself a steamy cup of tea, give yourself a neck or shoulder massage. Just go ahead and give yourself a spa treatment, soak in a hot bath or a shower. Another thing you must be aware of is your drug triggers. Your recovery does not end at getting sober. Your brain still needs time to recover and to rebuild connections that changed while you were addicted. And so during this rebuilding, drug cravings can be so intense. I won't lie to you. And you can support your continued recovery by avoiding people, avoiding those places and situations that trigger your urge to use. You know them. Step away from those friends who use. Don't hang out with friends who are still doing drugs. You will fall back. Then surround yourself as you are falling back, as you are stepping away rather from those friends that are still doing drugs. You need now to surround yourself with people who support your sobriety, not those who tempt you to slip back into that old destructive habit. And then avoid bars and clubs. I've seen people asking me that, see, yes, I've stopped taking drugs, but I still need to go clubbing and all of that. No, even if you don't have a problem with alcohol, drinking lowers inhibitions, drinking impairs judgment, which can easily lead to a relapse. So drugs are often readily available in those clubs, and the temptations to use can be quite overpowering. Okay, so avoid any other environment as well. Avoid every other situations that you associate with drug use. And also Another thing I want to mention here is that you should be upfront about your history of drug use whenever you are seeking medical treatment. And this is for those people that are addicted to prescribed medications, prescribed drugs. If you need a medical or a dental procedure done, be upfront and find a provider, find a doctor who will work with you in either prescribing alternatives or the absolute minimum medication necessary. Don't feel ashamed. Don't feel humiliated about previous drug use or be denied medication for pain. If that happens, find another provider. Are you with me? So use caution with prescription drugs. If you were addicted to a prescription drug, such as maybe opioid painkiller, you may need to talk to your doctor about finding alternate ways to manage that pain. Regardless of the drug you experience problems with, just know that it's important for you to stay away from prescription drugs with the potential for abuse, or use only when necessary and with extreme caution. Drugs with a high abuse potential include painkillers, sleeping pills, and even anti-anxiety medications. Be careful when you are using those medications. All right, so how do I cope with drug cravings? How do you cope while you are undergoing treatment? I want to believe right now that, okay, fine, you've started treatment or you are done with the treatment. How can you cope with the drug cravings? Sometimes cravings cannot be avoided, and so it is necessary for you to find a way to cope. How do you cope? Let me quickly give you some tips. 1, get involved in a distracting activity. Read, see friends, go to a movie, immerse yourself in a hobby, maybe an exercise. Once you are interested in something else, you will find that the urges will just go away. They will just go away. Are you with me right now? All right, another thing is for you to talk it through. Talk to friends, talk to family members about craving when it occurs. When it comes like that, just look for people that you can talk to when you are experiencing it, and don't be ashamed. Okay, because when you are talking to them, it can be very helpful in you be able to pinpoint the source of that craving. Also, talking about craving also helps you to discharge and relieve that feeling, and will help to restore honesty in your relationship, especially with your friends and family members. So craving is nothing to feel bad about. Another thing you can do is for you to challenge and change your thoughts. When you are experiencing a craving, many people have a tendency to remember only the positive effects of that drug, and you forget the negative consequence. So what do? You now find it helpful, to remind yourself that you really won't feel better if you use, and you stand to lose a lot. Sometimes it is helpful to have these consequences probably listed on a small card, and then that you can keep with you, or you can paste on your wall in your room. So challenge and change your thoughts. Once it comes like that, don't look at the positive or the vibes it will give you. Look immediately to the consequences those drugs are causing for you. Okay, are you with me? Another one, I call it urge soft. Urge soft. Many people try to cope with their urges by toughing it out, but some cravings are too strong to ignore. They are too strong to ignore. So when this happens and you discover that, yes, you have tried to challenge and change your thoughts, you have tried to talk to someone and still it's not going, it can be useful. When this happens, it can be useful to stay with the urge until it passes. Just stay with it. Yes, don't challenge it. This technique is called urge surfing. Imagine yourself as a surfer, as a surfer who will ride the wave of your drug craving, staying on top of it until its crest breaks and turns into less powerful foamy surf. When you ride out the craving without trying to battle, without trying to judge or ignore it, you will see that it passes more quickly than you think. And so let me quickly give you the 3 basic steps of urge surfing. Number 1, notice how you experience the craving. Sit in a comfortable chair with your feet flat on the floor. Okay, and your hands in a relaxed position, like this, in a very relaxed position. Then take a few deep breaths and focus your attention on your body. All right. So notice where in your body you experience the craving or the urge and what the sensations feel like. You can try it now. So verbalize, say it out, verbalize what you are experiencing. For example, you can tell yourself, my craving is in my mouth and nose and in my stomach. And so when you've been able to identify those areas, now focus on that area where you are experiencing the craving. Still sitting down. What are the sensations in that area? Describe them to yourself. To yourself now. For example, perhaps you feel hot, or you feel cold, or you feel numb or tingling. All right? Notice, okay? After you have noticed it, just focus on that area. Maybe your muscles are tensed up, or how large an area is involved. Possibly notice if the sensations change as you focus on them. Oh, my mouth feels dry. There's a numbness in my lips. When I swallow, I can imagine the feeling of using. So focus on that area. So repeat by focusing on each part of your body that experiences the urge. Now describe to yourself how the sensations change, how the urge comes and goes. Many people that have tried this notice that after a few minutes of urge surfing, their craving has disappeared. What is the purpose of this exercise? The purpose of this exercise is not to make the urge go away, but for you to experience it in a new way. If you regularly practice urge surfing, you will become so familiar with your cravings, and then you find it easier to ride them out until they go away naturally. Do you get that? All right, thank you. So afterwards now, how do you build a meaningful drug-free life? How do you build it? You can support your drug treatment and protect yourself from relapse by having activities and interests that provide meaning to your life. It is important to be involved in things that you enjoy, that makes you feel needed and add meaning to your life. You can't leave treatment and then be idle. It's not possible. You are likely going to relapse. So when your life is filled with rewarding activities, when your life is filled with a sense of purpose, your addiction will lose its appeal. And that is why we tell people that after treatment or during treatment, make sure you are gainfully employed, or make sure you are doing something that maybe you are in your purpose. Let me put it like that. Maybe you are in your purpose, all right? And so most of the time, what do? We make people to discover their purpose. Yeah, that should be part of treatment. Part of your treatment options. You have to discover your purpose, and then how to fulfill. Because one thing for you to discover your purpose is another thing for you to fulfill it. So while in treatment, make sure that the team that is treating you helps you to discover your purpose in case you've not discovered it before. And so another thing is for you to pick up an old hobby or try a new one. Do things that challenge your creativity, things that spark your imagination. I know somebody may likely say, no, must I pick up an old hobby? Want it to push me back to my addictions? No. Most of the time, people drop what they love. When they are addicted, they forget about things they love doing. I mean, the positive things, because that addiction will take their time. So it is good for you to pick up an old hobby, but if you know it won't help, you can try a new one. Something you've always wanted to try. Maybe you have to learn a musical instrument. You can learn a foreign language, or even try a new sport, okay? Maybe basketball or football. So, and also you can adopt a pet. You can adopt a pet, yes. In fact, how? Pets are a responsibility. So caring for an animal makes you feel loved and needed. So pets can also get you out of the house for exercise, okay? Spend time in nature. Take a hike, go fishing, go camping. Don't lock up yourself in the room. Take regular walks in a park, or just walk around your vicinity. Enjoy the arts. Visit a museum. Go to a concert. Go for conferences. Go to a play. Make sure you are doing something. Make sure you're not just sitting down in one place, take an art class, go ahead and write, get involved in your community. Replace your addiction with drug-free groups and activities. You can also start, a group. You can start a help group, okay, where you also will help other people. Are you with me right now? So you can volunteer, you can become active in your church or faith community, join a local club or a neighborhood group, and then set meaningful goals. As you are doing all that, make sure you have goals that you are working towards and something to look forward to, and that can be very, very powerful antidote to drug addiction. It doesn't matter what the goals are anyway, just that they are important to you. And another thing is for you to practice self-care, look after your health. We have discovered that so many people that are addicted to drugs, they don't take care of themselves. And that's why you see them smelling, they will not take their beds and all of that. So look after your health. Regular exercise, adequate sleep, healthy eating habits will help keep your energy levels up and also your stress levels down. The more you can stay healthy and feel good, the easier it will be to stay sober. Don't let relapse keep you down. And that's the last point I am going to be taking. Don't let relapse keep you down. Why am I saying this? Relapse is a common part of the recovery process from drug addiction. Yes, I know relapse can be frustrating and discouraging. It can also be an opportunity, to learn from your mistakes, identify additional triggers, and then you correct your treatment course. And what normally causes relapse? Different triggers can put you at risk of relapsing into old patterns of substance use. While specific causes of relapse differ from one person to another, let me quickly mention some common triggers. And one, negative emotional state, such as stress, sadness, anger, or trauma. That is a trigger. The same way negative emotional states can trigger you into relapsing into substance use, positive emotional states can also trigger you. And that is why some people will tell you that be careful of acting, or be careful of how you behave whenever you are too angry or you are too happy. When you are feeling happy or you just want to feel even better, maybe you're having a good time with friends, be careful. That can be a trigger. And also physical discomfort is a general common trigger, maybe pain or withdrawal symptoms. And sometimes a trigger may be you trying to test your personal control. How do I mean? Let me just use once. Maybe I can just have one pill and let me see. Okay? You are testing your personal control. That can make you to relapse. Another one is strong temptation or urge. That craving to use. It will come. It's a common trigger. It's a common trigger. And also social pressure can also be, it's also a common trigger. Yes, being in a situation where it seems everyone else is using, and that is why I said in the first place that avoid those areas, avoid places, avoid people, avoid situations that can trigger you into using the drugs again. So the important thing to remember is that relapse does not mean drug treatment failed. It doesn't mean drug treatment failure. Don't give up. Call your sponsor, talk to your therapist again, go to that meeting, schedule an appointment with your doctor. Do not give up. When you are sober again and out of danger, look at what triggered that relapse, what went wrong, and what you could have done differently, okay? You can choose to get back on the path to recovery and also use that experience now to strengthen your commitment. Thank you for joining me this day. Of course, this is the first series, like I said earlier on. Next week, I am going to be dropping another episode and I'm going to be talking about behavioral addiction. And then the third series, I'll be talking to caregivers and parents. Thank you. Until we meet again some other time. Like I said, my name is Atinuke Akinlawo, Atinuke Deborah Akinlawo, popularly called Pada. And I'm of the opinion, and I strongly believe that broken crayons can still color. Not just color, but broken crayons can still color beautifully. Thank you and God bless you. I do well to subscribe to my YouTube channel, Tinuakela One Ministries, for more content, and I'll be glad to have you on board. Thank you.